So, ladies and gentlemen, my name is Sharon Reihman, and I'm part of the executive team and the leadership team at the Lyme Disease Association. And today we're starting part of our May Lyme project for 2023. We'd like to bring education and gifts and hope to our the people that we serve in Australia. People who are sick after a tick bite, or most people often don't know they have a tick bite, that are not finding answers and are looking at Lyme as a possibility. Today, we're very privileged to have Dr. Kristin Reihman, and I'm just going to tell you a little bit about her background. Dr. Kristin graduated from Yale College in 1992 with a major in American Studies, and then spent 3 years completing pre-medical requirements at UT Austin and 2 years teaching the MCAT for Princeton Review, fine-tuning her mathematical skills. She attended Stanford School of Medicine in 2004 and family medicine residency at Lehigh Valley Hospital. Passionate about integrative medicine, Dr. Reihman trained in all sorts of non-traditional modalities so she could help her sickest patients and make the world a better place. The training included medical acupuncture, Ballant credentialing, craniosacral facial therapy, the art of hosting autonomic response testing, and the International Lyme and Associated Disease Educational Foundation's provider training program. Dr. Reihman opened an integrated, holistic, complex practice out of her home in 2012 and has been developing a wellness center, Trout Creek Healing Collective. Her first ebook, Life After Lyme, Revive Your Inner Rockstar and Achieve a Full Recovery, was published in 2018. Dr. Reihman has a loving husband and 4 beautiful, creative, and spirited children. She says raising them is the most meaningful work she does. Dr. Reihman believes that every one of us has a unique and important contribution to make if we're going to heal the earth for ourselves and future generations. She says, I help to recover people from complex, chronic, medically mysterious illnesses so I can contribute to bringing all hands on deck. It is incredibly meaningful work, second to only raising my children. I believe that life is a team sport. We were not meant to do this alone, and my ultimate goal is to empower others with the tools, practices, and mindset shifts to be able to heal themselves naturally, joyfully, and sustainably so they can get back to living their amazing lives. Every time I read that or speak, I get goosebumps, Dr. Reihman. I feel so privileged to be here with you.
Thank you, Sharon. Thank you. Well, I'm so honored to have been asked to speak during your May Lyme Awareness Month. As you know, Lyme is a subject near and dear and ever present to my heart. So I'm happy to be here and eager to share whatever might be helpful to your audience.
Awesome. And I think, let's start with your journey into medicine, because it was fairly unique. It seemed very determined and sort of, I was going to say premeditated. That's probably not the right word, but you really thought it through, and you had a long-term plan for who you wanted to be as a doctor.
Yeah, well, I guess it started when I was a young child. My father was a neurosurgeon, and I would visit the hospitals with him and do rounds with him on weekends. And occasionally, as a teenager, I would, scrub in on a brain surgery or a neck surgery. I think I might have almost passed out one time watching him tap a little chunk of their hip bone into their cervical spine. But I think I saw myself as a doctor as a young child. And then maybe in my teen years, thinking about college, thinking about what really that might look like, and recognizing that my dad was busy a lot growing up. At that point, I think I said, well, that's definitely not what I'm going to do. I want to have a life. I want to have kids. I want to travel the world. I don't think I can do medical school. And so it sort of got put out of mind for a long time. And then, as you said, I went to Yale. I majored in American Studies, which is sort of a history, popular culture and history and artifact study. And then I went to China for 2 years and spent a couple of years there teaching English because I really had no other plan. I was kind of a gypsy spirit. And I think coming back from China was really important for me because being there was so different. I learned a totally different language, and I traveled, and I was completely away from all my family and all my touch points of kind of who I was. And so when I got back, I really felt like a new person, like kind of an unformed person. It's almost like the whole experience had squeegeed everything away, including this notion that I can't be a doctor. So I remember this very distinctly. I think it's the only epiphany I've ever had and probably will ever have, but it definitely was that. I was driving across country with my then boyfriend, now husband, And we were having a conversation about, okay, what next? You just went to China. And what are you going to do? And I said, I don't know. I feel like I don't even know what jobs exist. And he was like, well, very practical, make a list of the jobs you know. And I was like, doctor, just the first thing that popped out. And he goes, go to med school. And all of a sudden I saw my life in front of me and I was like, oh my gosh, that would actually make the best use of my gifts and my skills and my desire to serve. And I want to be an OBGYN. Like that's the first thing that popped in my mind. I was want to deliver babies. And so I spent and of course I'd done nothing in college to prepare me for medical school. So then I had to go back to school and get all these requirements. And that's when I was teaching the MCAT, partly as a way to discover, can I actually do science and math? Like I'd never really done that before in college or at that level. And indeed I could, and indeed I loved it. But that whole time I was sort of sitting with this strange epiphany and kind of doubting it. But I was moving in that direction because it felt really true. And so ultimately I did go to medical school. I went to Stanford, as you said, and my first rotation was obstetrics and gynecology. You know, we do the preclinical years there, and then we do a couple of clinical years. And my first clinic was OB, and I loved delivering babies, and hated everything else about OB, like hated the surgeries, hated the intensity, hated the cattiness, just hated everything about it, except for being with women in this very sacred moment of bringing a child into the world. And what I ultimately discovered at Stanford was that family medicine allowed me to do the parts of OB that I loved and then continue to take care of the whole family. So that was really my goal once I got through medical school. I want to be an OB, and I want to, deliver babies like midwives deliver babies, like really birth with women naturally and help them find their power, and then teach them how to breastfeed and support kind of this beautiful like evolution of their family. And I did that for several years until I got sick from Lyme disease. So Lyme disease really put an end to my ability to get up in the middle of the night for my patients, and took me on a totally different path.
Wow.
Which we can talk about that too, if you want, but that was kind of the impetus of me going to med school and how that happened.
Well, let's talk about your journey with Lyme personally. That must have been horrific.
Yeah. I mean, I call it my near-death experience. And it wasn't the first time I had Lyme. The first time I had Lyme, I was in residency, which is our training after medical school before becoming a full attending. And at the time I was, nursing my third child and staying up, very late and exhausted from the work I was doing, and got a tick bite. And at the time I guess I should go backwards, because at Stanford, I remember this moment in listening to my professors talk about Lyme disease, the moment we learned it, like I think I would call it like a really finely tuned BS monitor in my head. Like if something comes out of someone's mouth that doesn't feel true or doesn't make sense, there's this little part in my brain that like puts a pin in it. And they're like, okay, the jury's out on that. We haven't really heard the last of that, right? And that definitely happened when I was learning about Lyme disease in med school, because they said something like, well, 80% of people recover no problem with 3 weeks of doxy. And, so many people, come up positive on the test. But I kept thinking, but what about the people that are missed? And what about the 20%? And then they said, and sometimes people end up with these long lasting chronic issues that include like arthritis and heart disease and brain problems and nerve problems. And I was like, hold the phone. Like, what about those people? Like 20% is a pretty big chunk. Like, why aren't we talking about that? So in my mind, I was like, well, clearly, 3 weeks of doxy or 4 weeks of doxycycline for someone who has a positive test is not going to capture everybody that needs it. And that was the end of the story as far as I was concerned, but it was never like a finished story. So when I got a tick bite, I remembered, wow, so I don't want to be one of those 20%. I'm going to treat myself with doxycycline. I had the capacity to write my own prescription, but I went to an attending and asked her to write for me. And she wrote me 3 weeks of doxycycline, and I took it. I never had any symptoms with that, despite the fact that I was kind of a rundown resident. So I figured it was a done story, and I went back to my life. Well, fast forward to my first couple years as a junior attending faculty, teaching residents and medical students and running an acupuncture clinic and delivering babies and, nursing my fourth kid, and really run down at that point. My immune system was really in the toilet at that point. And I had a patient come to me who was about 55, and she was an artist's model. So she, her job was to pose in the nude for young artists and people learning how to draw the human form. And she was very skilled at this. Like people would come to her to learn how to do what she did. And she came to me and said, I can't do my job anymore because I am peeing all over myself. I can't control it. And they've worked me up for, incontinence and all these other things. And I don't have that. What I have is Lyme disease. And I'm pretty sure Bartonella and Babesia because I have all these other symptoms. Meanwhile, my head's exploding because I hadn't heard of, Babesia and Bartonella since medical school, since my step 1 boards, like when we learned them as these rare bloodborne, blah, 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 cat scratch, nobody gets them kind of thing. And so I was like, wait, what? And she's like, yeah. And nobody believes me. And if you're going to be my doctor, you're going to have to, read this. And she hands me a stack this high of, printed out pages from the internet. And I was like, I'm going to read that. Because this woman's not lying to me, right? She's a reasonable, smart person who's had some devastating thing happen. And I believe people like when they tell me I'm different and this is not me. So I took that home and I read it. And as I was reading it, I was like breaking out in sweats myself. And I was thinking, have been feeling terrible for a year. And what I'm learning from this woman and all this internet research is that you can culture Lyme out of a knee of someone who's had a year of, ceftriaxone 10 years after the fact and is asymptomatic, and there's still Lyme in his knee. Like, what's going on with this picture? You can culture it of dogs who've had 5 months of doxycycline. You can find it in placentas of miscarried babies. You can find it in bird poop and mosquitoes and sand fleas, and not just the black-legged tick, right? So I was freaking out because not only was I feeling like, oh my goodness, I've missed all these people's diagnoses, all these people who are suffering and have come to me, and I've dismissed them saying it can't be Lyme because you don't meet the criteria. I was learning that the criteria were completely biased and politicized. And I was also learning that I probably had a reactivation of my own Lyme, which is why I had been having such, symptoms of exhaustion and not being able to sleep well and sweating at night. I mean, all this stuff that I figured was just breastfeeding a baby every hour on the hour for a year, So I really was struggling with, do I wean my baby, my last child, who I plan to breastfeed until he's in college? Like, do I wean this child in order to get on an antibiotic for years, or which is kind of what I was learning a lot of the ILADS doctors were doing, and was so outside my practice at that point, right? It's just so different, but it felt like the right thing to do. Or do I just need another tick bite to convince me that this is what's really going on? Like, I really remember saying that in my mind, Sharon. And I kid you not, 3 days later, in November, which for us is winter, I pulled a tick off my rump in the middle of the night while I'm breastfeeding. And I was like, okay, here we are. Like, I guess I got what I asked for, right? So be careful what you ask for is the first message I have. Oh my God. So anyway.
The God thing.
Yeah. So long story short, I got the full bullseye rash at that point. I got the full sickness. I was like night sweats and sleeping 12 hours, still working, trying to muscle through work, but I got a doctor to put me on Doxy. I basically took him a stack of internet research and was like, listen, you need to treat me for this, or I'm going to treat myself, but I prefer it to be you. Partly because I wanted to educate people. There's always that little piece of me that's like, I may be in the toilet right now, but you all have to learn this stuff, right? So I was really trying to bring everyone up with me, but ultimately I would have treated myself if I had to. And I treated myself for 3 months, or he treated me for 3 months with doxycycline at double doses. And because that's what I was learning. I was kind of at that beginning stage of learning from like Western trained doctors, so MDs and DOs who were using the tools I learned to use, but using them at much higher doses and for much longer lengths of time. And basing their treatment on clinical symptoms as opposed to a lab test, because I didn't have a lab test at that point. I think I might have come back positive for rickettsia, of all things, at that point. But I didn't care. I was like, I'm in the ring with Lyme. I know it's Lyme based on all my symptoms and what I'm learning. So it was 3 months of me exhausted trying to work through it. Believe it or not, that was not the near-death experience. The near-death experience came a couple weeks after I stopped the doxycycline. And I felt great during those 2 weeks. I mean, I really had gone through hell, but had come out the other side. And then I was like, wow, I'm better. Like, I really feel back to better. I wasn't nursing anymore. That was probably part of it. But I felt better. And then 2 weeks later, almost like as if, the life cycle of Borrelia is really a thing, right? I just woke up one morning with terrible symptoms. And the worst of them was like a sciatic pain that was just shooting down my right side. And I think I muscled through work for another week, but like lying down in between patients and still sleeping 12 hours. I mean, everything was back. And for me, that included joint pain and some nerve stuff and terrible brain fog. I mean, I shouldn't have been caring for patients, frankly. And after that week, I checked myself into the hospital because I was in intractable pain and I couldn't manage. And a week later, I came out of the hospital. I'd gotten an epidural steroid injection, which I did not want to have, but nothing else they were doing would cut it. So what did I do? I was on iLads on the phone with Ann Corson, who was kind of like, I had her on speed dial, and she was like a past president of iLads and the person I'd done a lot of like calling and sort of picking her brain. I later did my preceptorship with her. She's a lovely person. But and I remember none of this, by the way. I documented everything. So later I was like, wow, look at all the stuff I did. I took good notes, but I was not there. And, convinced the team to give me 3 antibiotics IV for 3 days before they put epidural injection in my back, just because I was like, I don't want to reactivate the line. They must have thought I was crazy, right? I was trying to control it all and ultimately spiraling the drain. So I went home and spent the next 3 months in my bed, not able to move, just in so much pain. The epidural did nothing. And, I don't know what really turned things around. I feel in my heart that it was a particular question that came from a beautiful naturopathic, homeopathic family doctor in my town who I'd somehow gotten connected with that year. And at some point she offered to see me. She heard what was going on. She was like, listen, let me work with you. Come to my office and I'll work with you. So someone drove me to her office. I was on so many drugs, Sharon. I had patches everywhere. I mean, I couldn't drive. I'd lost 30 pounds. I mean, I looked terrible. And someone drove me out there, and I sat on her couch for 2 hours and told her my whole story. And at the end of the story, she said, wow, well, I think we've discovered your remedy. I'm going to go, whip it up, my homeopathic remedy. I'm going to go whip it up in my kitchen and bring it back, and I'll teach you how to take it. You just lie there until I get back, and then you'll let me know, how your pain is tomorrow. And I was like, my pain isn't even the worst of it. Like, how did I leave her with the impression that my pain was the worst of it? And she goes, what's the worst of it? And I said, I feel like I'm dying. I feel like my body is trying to die. I feel like I have to think about taking a breath. I smell like a corpse. I smell like my mother smelled when she was dying of cancer at age 42. And by the way, I was turning 42 that year. And by the way, I'd always thought that I would leave my 4 children at 42, because when my mom did, I just sort of, that felt like the pattern in my family. And I realized in that moment that even though I'd flipped that script long ago, I had my own kids. I'm like, of course I'm not leaving my own children. That's her story. But I felt like I was living out that script. And I said to her, wow, I hadn't even told you, that last week was Easter, which was the day my mom died. And last week was also the day I came downstairs and my husband said, wow, look, mommy's downstairs for dinner. And I was like, what are you talking about? And he goes, what are you talking about? You haven't been downstairs in 5 weeks. And I had this moment of oh my God, I've really done it. Like, they all think I'm dying. Like, I've done it to my family, whether I'm actually dying or not. Like, I've killed myself off for my children. And I said, to kind of make light of it and maybe dismiss that thought, I was like, come on, guys, you must have thought I was up there dying or something, as a joke. And they all nodded and looked down at their plates. And I was like, whoa, who really thought mommy was upstairs dying? And everybody except Baxter, who was 12, raised their hand. And I was like, wow. So she said at that moment, well, it sounds like you have a choice to make. Your mother made her choice, and you have your choice. So are you trying to live or are you trying to die? Because it makes every bit of difference in terms of how I support you on this journey. Text me tomorrow and let me know what your choice is. And I was like, right? Because like that was the only question to ask. And she asked it. So my husband picked me up from that, and I got in the car with him, and he said, I told him the whole thing, you know, and he was like, do me a favor and text me as well with your choice. I was like, you poor man who has seen me disappear and melt away upstairs. So I got home that night and I lay in my bed and I was like, how do you even begin to make a choice like that? And I was like, well, how do I make any choice? I think about myself on one path. I feel the feelings of it. And I know if that's the right path. And then I think about myself on the other path. And I feel that's sort of always been my method. So I thought about myself dying. And there was no emotion. I was like, yeah, I've already done it. Like it's already, like my kids have already processed that at some level. Like they're going to be fine. Greg will get a new wife. You know, it'll be fine. They've figured out how to cover for me at work. Like the world will continue to turn without me. But there was no emotion, which I found surprising. And then I was like, okay, what's the other choice? I could live. And again, there was no like explosive emotion, which usually there is for me, but rather there was this like crisp and immediate clarity. It wasn't a booming voice, but it was like a knowing that said, yeah, you could live, but if you live, you're not living for any fear of the kind of doctor you're becoming or the politics of Lyme. You're not living for any BS or any lies or any living out of integrity. You're not going to, go back to your job in a hospital setting that's toxic and do a bunch of things that make you feel out of integrity. Like you're not doing that. If you're staying for love, joy, and jumping on trampolines with your daughter. Like that's a requirement. And I was like, okay, well, I'll sit with that. So I fell asleep with that. I woke up in the morning and I was like, okay, what's my choice? I had the same kind of inner conversation. I was like, well, I'm just going to get up. I'm going to take the next step. I'm going to go to my physical therapy today like I'm supposed to. And I bounced on the little bus to physical therapy, got in hot water for an hour, bounced back, still no clarity, got out of the car and walked to my garden. And in my garden, I saw the red bud tree, which is one of the first trees to flower in the spring, was blooming. And I was like, oh my God, it's springtime. Wow. And then I was like, wait, what am I doing sitting in the garden? I'm not in my bed. This is not how dying people behave. I think this might be my body making a choice. And I texted the homeopath. I was like, I don't know what really the choice is, but I'm telling you, I'm in the garden right now and the red buds bloom. She was like, great, continue to keep me posted. And that night I got to bed and I got into that bed and I was like, hello, stranger bed. I've been cheating on you all day with like being upright and in pain, but not suffering anymore. Like the pain was not gone. Like, let's be clear. It was still 10 out of 10 pain. I had to lie down every few minutes on the floor to reset my back and my sciatic nerve, but the suffering was like gone. And I wish I could say that it was like, a clear path out of that, but it took about a year and a half for me to fully return to my body and fully commit to the prospect of being alive and, following the criteria that I'd sort of set out for myself. And if you're going to live, you're going to live for love and bliss and bouncing on trampolines. It took me a couple more years to bounce on trampolines, but I think I stayed in the same direction, So it was the weirdest decision of my life. It's not how I like to think of myself as an intentional person who uses emotions, but uses logic. It was the weirdest decision of my life. My body walked to the garden and that was kind of the first step. So, what really changed things for me, I think it was that question. And I think it's a question I ask my sick people too. Because the truth is, if you haven't made that decision, no one can make that for you. And no one can really support you because you don't have a direction yet.
What a spiritual journey.
Yeah.
And so, not to walk over the sensitivity of that, I'm still vibrating with that, but Let's move to how we can help people. What, you look at things quite uniquely. And one of the things that struck me was starting with the foundations of a healthy body. What would you say that is for people listening today?
Yeah. Well, I mean, I think it's the basic stuff that we all at some level know is important, but that we ignore at our peril, you know, like sleep, water, eating a diet that agrees with our bodies. Most of us are walking around eating a diet that's making our body cranky in some way or another. And so people learn to live with, chronic annoying symptoms, but those symptoms are actually telling them you're inflaming me, which means your immune system's, not going to be present or on point when something like Lyme or COVID or whatever the next thing is comes around, right? So a lot of people who get Lyme do fine. They do fine. Get rickettsia, they do fine. Their immune system comes and manages it. Same thing is true of, the new virus that we're all whipped up about in the last few years. The same thing is true of anything, right? Not everyone who is in a room with someone who gets the flu the next day gets the flu. It has to do with the terrain. And the terrain, which includes your immune system, includes your detox pathways, includes your thoughts, includes how well rejuvenated your cells are and how uncluttered they are with toxins. All that stuff matters when, Lyme comes knocking. So I think the first time Lyme came knocking, I just wasn't as toxic. I think the second time Lyme came knocking, I was pretty depleted. I was, 6 years beyond that and lots of babies and breastfeeding and late nights and delivering other people's babies. And I think it took a toll. And so I
Hospitals are
think
pretty toxic.
oh gosh, they're the worst. They are the opposite of healing environments, unfortunately. I mean, if you even just look at the cafeteria, like what people are served when they're in the hospital, it's almost like you're trying to kill me. You're trying to keep me sick. Yeah, so I think the basics are basic, they're foundational. So if, for example, sleep, if you're using an alarm clock to wake up in the morning, by definition, you're not getting the sleep your body needs. Period. Full stop. Like your body will wake up when it's rested enough. That doesn't mean you feel good, but it means your body will wake up. You will become awake and more alert and your eyes will open. And if you're using an alarm clock, you're not getting the sleep you need. You're cheating yourself out of minutes, maybe hours every night, and that stuff is cumulative. So I really encourage people to stop using alarm clocks. And maybe that means going to bed 2 hours earlier or 3 hours earlier, or not turning on a screen after dinner, or not turning on lights after dinner, like live the way our ancestors lived, which was by the sun and the moon, and not putting bright overhead lights and other things and blue lights and screens and, phones in our bed. So that's a foundational one. And that for me is probably my most important non-negotiable. I can go without eating a perfect diet and not get super sick. I can go without, I can get dehydrated, let my lips get dry, which means I'm already a liter behind and I'm not going to tank. I mean, all those things were super important to me when I was recovering from Lyme, make no mistake. I mean, I had a very fine line, which was my buffer between, dietary indiscretions, any kind of lifestyle indiscretion, and then feeling the result. It's like that big buffer that we have as kids just shrinks over time. And when you get Lyme, it just goes to a thin line. And it the second you make a choice that's not in alignment with your immune health and your overall wellness. But now for me, it's sleep. Sleep is the thing that I, definitely can't skimp on. But then, drinking water. People put a lot of things into their mouths that aren't real food and aren't real, beverages. Our body needs at least half of our body weight in ounces of water every day. That's pounds to ounces. Sorry, you guys might have to do the math on that. But, really making sure you're hydrating, and sometimes 3 times that, especially when people are herxing. I mean, Herxheimer reactions are essentially an overwhelming toxins in the body. And so I encourage people to just lean into those natural detox tools like Epsom salts baths and water drinking, as well as some other supplementation, but the basics are still the basics. And then of course, food. I mean, I can't tell you how hard it is to help people get well when they're insisting on putting things in their mouth that aren't food. And I would include any sort of like sodas or processed foods or things out of boxes and cans and jars that have more than 5 ingredients, or certainly ingredients you can't pronounce. Those are always a tip off for something not being whole, real food. And it matters. It matters. And often I'll even tell people like, you've come to me several times. You're not changing this one thing. I don't know that I can help you until you do. I really don't. So how can we work on this? How can we figure out what obstacles there are to you eating foods that are in alignment with your goal of healing? Because we've already had that conversation, right? No, the goal is to heal and not die. Okay, so if that's your goal, how do we stay in alignment with it in everything you do?
Awesome. And so then moving to Lyme and associated disease patients, what's your first priorities?
My first priorities are the basics. I wrote a book on how to recover from Lyme disease based on my own experience. And I will tell you that every doctor or naturopath, chiropractor, human who writes a book on Lyme disease is going to put in there the stuff that worked for them, the stuff that works for them and their patients. They use the stuff on their patients that worked for them. And so everyone has their own unique box of tools. One of my most important tools is the diet. I start everyone on elimination diet, which is a diet that helps to take out all the inflammatory foods first. And then after a 3-week period, once the person feels better, and most people do feel a lot better after 3 weeks of eating no inflammatory foods, we add things back one at a time. In the context of a healed gut, it feels different. Like your body will tell you if something's not good for you. And then you have this really quick litmus test that tells you, okay, well, that should be off my plate until I'm back to rock star. I want people to get back to their rock star. I don't want people to suffer on and on and on. So if the goal is to heal, let's heal all the way. And the diet has to be dialed in. And once they do the elimination diet, they know what should be on their plate moving forward. I don't have to tell them anymore, right? They've had an experience. So I start there. And my book is the same way. My book starts, it's kind of like a choose your own adventure for Lyme disease. So I start with a little bit of my story, and then I start with this big question, which is, do you really want to be here? Because it's not worth wasting your time on the rest of the book if you're not sure yet, right? But it's worth sitting with that question. It's worth your time. It's a high value question. And then I talk about complexity, because complexity is, I think, the nature of the game with Lyme disease. Lyme's not simple. Everyone who has it knows it's not simple. A simple problem is a problem where everybody understands the problem at like first glance. Everybody knows what the solution is, right? It's like the problem of you pull an all-nighter in college and you're exhausted the next day. Okay, everyone knows what's going on, right? There's no mystery about what the problem is or what the solution is. Get your sleep. Well, those are simple problems, and they don't usually exist in the Lyme world, right? It's certainly not in communities like this, where the simple answer, if the simple answer was simple for you, and if it was really true for you, it would have worked, you wouldn't be here. Complicated problems are sort of a series of simple problems strung together. So they're problems that maybe you need an expert to help you with because they know the algorithm, right? They know the pathway through and they can help guide you. Or maybe it's something that you can learn on your own, but it's definitely going to take multiple steps. And yet you're going to get to a predefined, you're going to follow a path that everyone follows and you'll get to the end. That's complicated. Lyme is not complicated. Lyme is complex. Lyme is complex because the terrain is shifting all the time. It's like being in Hogwarts Castle and trying to get to the door up there, but the stairs just move. And you're like, well, I'm in a different room and there's a 3-headed dog. Like, what's this, Because Lyme isn't just a bug. It's a terrain issue too. And it's a detox issue too. And it's a thought issue too. It's a fear issue too. There's a lot of things that sort of get woven into this illness that kind of make it worse or better at times. And so by nature, a complex problem, you have to be willing to ask big questions and many questions and kind of probe all corners of the known universe for possible answers. And when you find an answer that seems intriguing, you need to lean into it. And you need to do a little mini experiment. You might call it a PDSA cycle if you're in business or a corporate world, right? Like you do a little plan, do, study, act, where you make a plan based on this idea you have that might work. So-and-so did this for her Lyme. She got better. I'm going to try that. And you try it and you see how it goes and you take notes and you pay attention. And if you feel a little better, or you definitely don't feel worse, you might do more of it. You might do more of the stuff that works. You do less of the stuff that doesn't work, or the stuff that causes you major herxing, unless you're going to tweak your detox, right? And so ultimately, that's how you get through Lyme, right? And you don't know what the path's going to look like in advance. You can look back at the end and be like I can look back with that question and say, well, What are the things that really made a difference? That question made the big difference, right? For me. But there were 20 other things before and after that that probably contributed to me being in the, in the place where I could make use of that question, to having the tools and the knowledge and resources and different techniques to try after that question that over the next 2 years I could use to continue climbing out of that hole. And so in retrospect, sometimes we can understand how we got through Lyme, but it's not something we can know in advance. And the journey looks different for everybody, which of course makes it infuriating for linear thinkers and concrete, analysts and doctors, for example. It makes it infuriating because it's not an easy recipe.
No, it's not an easy recipe, is it? And before we get to your recommendations and strategies for killing the bugs, where do you prioritize mold and yeast overgrowth issues? Is it before you treat or during or all the time?
Yes. Before, during,
All
all
of
the
the
time.
above.
I mean, mold is the biggest confounder. So yeast, I think of yeast, I mean, they're certainly related, yeast and mold. I think when I think yeast, I think more of sort of the microbiome and what's sort of living in your gut, eating your food, driving your cravings. A lot of people crave sugar or crave sweets. We talk about a sweet tooth or comfort food. Nobody craves, ghee or coconut oil as a comfort food, right? People crave like carby things and pastas and breads and cakes. Well, all those things feed your yeast. And they also feed your Lyme, by the way. Lyme loves sugar. And it probably loves yeast. I mean, they're both rats. I think about like pathogens in your body. We all have some of them, but if we have trash in the body, if we have a lot of toxins, heavy metals, chemicals, GMOs, pesticides, like things that have built up and poor detox pathways out, which is probably a common phenomenon in all my patients, is that they genetically are just poor detoxers, or they have trouble getting rid of mold, for example. Well, I like the analogy of if you have like a kitchen full of garbage bags and you haven't taken them out to the curb, but they're just sitting in your corner, like the rats will come, the mice will come and the bugs will come because you've left toxins in your kitchen and they're there to come clean it up. Well, the Lyme is the same way. Lyme and yeast and parasites, all of these things are present because we've got garbage bags sitting around our body. And so I like to think about what are all the usual suspects of garbage bags that we can clean out, that we have in our control. This is where an elimination diet comes in. It's also where using non-toxic products or maybe no products for a while. Maybe don't wear makeup for a year or two while you're healing from Lyme because you're adding extra burden to your detox pathways that are already gummed up and dealing with all the Lyme detritus. So I think it's a matter of kind of thinking in this way systematically and kind of eliminating all the things we can that aren't serving us in our goal. Yeast is one of those things. It's there for a reason. It's, the yeast membrane can hold, I forget, like 100 times its weight in mercury. Like it basically becomes a mercury sponge. So, we're eating a lot of fish, or we're getting like silver fillings in our teeth, or maybe we're the firstborn of our mom who had a bunch of silver fillings. And like me, you took on 2/3 of your mom's mercury burden just by being in her belly. Like it's everywhere, right? And so the more we can mitigate and remove some of these toxins, the less likely we are to house these pathogens like yeast, like mold. Mold to me doesn't feel like it has as much of a consciousness as things like yeast. Like yeast, I definitely feel like has a consciousness. Like I'm in the room with yeasty people and I know we're all outnumbered. The person who's getting hangry and we just ate 2 hours ago and they're hangry again, the person who has to have the last cookie on the table, and you can tell there's so much tension because they're like, don't want to be that person, but you can tell their yeast are like, get the cookie.
Yeah.
Like yeast has a consciousness. Mold is more like a bioweapon, Mold, I mean, certainly you can have a mold infestation and grow mold in your sinuses and all sorts of things, but I typically think of mold as like a little toxin that's floating around and getting lodged and stuck in our nervous system, getting stuck in our, the membranes of our cells, gumming up our mitochondria, gumming up our detox pathways. So those are huge issues, and I don't usually take them on by themselves. I'm usually doing kind of a little of everything all at once, because I think it's important to, mop up that mercury that just is coming out of that yeast that you just killed. You know what I mean? You have to be detoxing as well as killing the yeast. And if you're eating fewer carbs, which I recommend people do, the yeast are dying. So there should be something on to detox. So another layer of complexity, I guess.
Very good. And what do you do to kill these little pathogens? How do you help people? Is it antibiotics or herbs or homeopathics or all of the above?
All of the above. Yeah. And more stuff that I'm learning. I just recently got into biomagnet therapy. I'm sort of curious about what that can do. I mean, I'm always looking for things, right? I'm always eager to know what's worked, because for everything you might tell me is a thing that works for Lyme disease, I know people who've said, yeah, that thing cured me. And I know other people who said that did nothing. And sometimes I know people who said that thing really hurt me, and this is like one more of the sort of bits of evidence that Lyme is just super complex. It's different in everybody. And some things that work for a person, in one chapter might not work with a relapse or the next time they get a tick bite. And so I think this is where I really believe in kind of listening to your body's wisdom, paying attention to that little inkling that says, oh, she got better with that. That sounds really interesting. I feel called to learn about that. Not because I'm afraid if I don't, I'll miss the boat. Like, fear is not what I'm talking about. I'm talking about what emerges when we kind of like get rid of the fear, So getting rid of fear, that's another foundational thing. I think people who have Lyme are often terrified. I mean, you feel like you're dying and nobody can see it. You feel alone. You feel, confused, and, everyone's gaslighting you. It's a terrible space to be in, and it can lead to a lot of toxic emotions that are only hurting the person who's having them. So I recommend that people learn tools. I teach them tools. I teach them tapping and other, judgment releasing things. They're all in my book, but I teach people things to help themselves clear out the schmutz, that's getting between them and a clear intuitive knowing about what the next step for them might be, or what something important to explore might be. So yeah, I have a lot of tools. I use antibiotics sometimes. They're my least favorite thing, maybe with the exception of in a very new case of Lyme and someone who hasn't been ill before. Because in someone who's been ill before and they've had simmering on and off illness or chronic illness, they may have had a new tick bite recently too, on top of that. But if they've been sick that long, their immune system's really in trouble. And so they need more than just, big guns coming out to kill the bugs. They need a terrain overhaul. And so that's the person who, and those are most of the people who come to me, is the people who need to really support their terrain, nourish their body, heal the gut, open up the detox pathways, change their mindset, get rid of fear, get back on a sleep schedule, start to move again, start to live again, living into the possibility of feeling better so that they can be on a path in that direction. And those people I prefer not to use antibiotics with, because they're just really toxic. So antibiotics are one thing. Herbs, I love herbs. Herbs help to rebuild the terrain. They support the detox. I mean, sometimes a single plant can do like 10 different things that are important for a Lyme recovering person, including help them sleep, including bring back their joie de vivre, including, detox them, including, heal the gut. So I love herbs. Yeah, and there are a lot of different companies out there now who are making herbs in combinations specific for people with tick-borne infections. So I'm not sure what's available in Australia. I don't know if you guys have Beyond Balance. It's a beautiful company from California. I'd use a lot of their products.
Yeah, patients can get that in.
They can. Yeah, it's a great company, and they do a lot of education for practitioners. So if you find a practitioner who uses those things, chances are they've gone through their educational pathways and they've kind of learned how to use them. But they also support the clinicians who are trying to learn them. Like when I was first starting to learn them, of course, I started on myself, and then I, called them up and said, here's what I'm doing. Here's my experience. And they're like, oh yeah, that's why this is working. And then I had, my first 5 or 10 patients, I would just make consults with them all the time and, get some support from them as I was learning, because I'm not an herbalist. But I've learned quite a bit about herbs and how to use them for Lyme and co-infections and mold and parasites. And then I have a couple other techniques, a couple other things I've learned. Can we talk about CD on this? I don't even know. Is that going to go over? Okay, because it's super controversial. But chlorine dioxide is kind of my favorite thing, actually, for Lyme, only because it's so cheap. It's so accessible. Can you guys get it there?
Yes. I mean, it is being shut down, but there's pathways.
Okay, well, stockpile it then, because it never goes bad. It comes in separate bottles. You make it yourself. It's a little bit of a learning curve to learn it. That's all in my ebook too. I explain how to use it. I learned from Carrie Rivera, who also who used it for autism to really great effect and still does, but just is sort of the person out there using it for chronic illness in a way that nobody else is. And yeah, the third time I had Lyme, after the near-death experience recovery, I was pulling out some kind of berry bush or maybe putting one in, and I felt suddenly the same like neurological weirdness in my jaw and my right big toe and my left wrist. I was like, all my Lyme symptoms are coming back. What's happened? I feel great otherwise. And I said, I must have been bitten by a tick. And I reached over, and indeed I found one on my shoulder. It had probably been on there for about 45 minutes.
Wow.
And as we know, or maybe we don't know, some people don't know this, but it's an important thing to know, tick saliva is tropic for Lyme disease and other infections. In other words, it's a magnet. So a tick bites you, and even if that tick is not carrying an infection in its belly to inject into you, just the presence of the saliva calls for the bugs in your body that like to infect, biting arthropods. Of course it does. How else would they know to go there, right? Like, it's not like you have Lyme flowing in every ounce of blood. So the Lyme moves towards the tick to infect it, and your symptoms reactivate. So a lot of people after a tick bite will think they have a new infection. Actually, they have a reactivated infection from the tick saliva, or maybe they have both. In my case, I think it was just reactivated, but either way, I got very sick. And at that point, I'd been learning about chlorine dioxide. So I decided to use it. I'd already gone through antibiotics and herbs with the last thing. And I was like, well, let me try something new just to see if it works. And it was probably the easiest imaginable Lyme course, given how terrible I was beginning to feel, of any that I'd had. It took me about 6 months, but by the end of the 6 months, I felt like a rock star again. And it was like a nice gradual, it wasn't even there weren't even terrible herxes. Chlorine dioxide is very titratable. Like you can tailor it to your symptoms. So you don't have to keep dosing it if you're feeling a little herxy. You just stop dosing, and the next day you go backwards on your dose and you slowly go up to your max dose. And so I find it to be very, very effective, very useful. It's great for mold, actually, for people who are riddled with mold. I think it's deactivating and oxidizing the mold in your body so that your body can remove it finally. And it doesn't kill parasites, doesn't kill huge parasites. It kills it oxidizes biofilm. So it can release parasites from their hiding places. And so people will often pass worms taking chlorine dioxide. Maybe that's too much on the first date with your audience here, but
okay. We're Lyme patients.
We all have worms, people. They're all in us. Yeah. And they like to house our Lyme. They like to keep our Lyme safe and sound inside them. So it's important to make sure that they're part of your eventual protocol to get rid of those guys. But yeah, I would say CD, also called chlorine dioxide, also called MMS in the past, is probably one of my favorite tools. It's not for everybody. I think one of the things that gets in the way for people is that it feels like you're drinking a pool, a swimming pool, and it smells like bleach. It's not bleach. People will think it's bleach. People will think it's a gas leak. You'll be in a meeting and you go to take your dose and someone's like, "Where's the gas leak?" And everyone panics. And you're saying, no, that's just me and my bleach, which
Magic
not
potion.
bleach, not bleach. But it's very effective. Yeah, it's a mild oxidant solution. So people who do ozone, maybe some of your people are familiar with ozone therapy. That's another oxidative solution. Hydrogen peroxide is another oxidated solution. Your body makes oxidizing molecules to kill pathogens. So in a sense, you're kind of using your body's own technology, although your body doesn't make chlorine dioxide. That's a man-made oxidizer that breaks down at the end of the day to salt, to sodium and chloride in water. So it's a pretty harmless solution for healthy human tissues, but certainly pathogens don't like it.
So let's talk about how do you know you're getting better, and also the herx process and your recommendations. Because it's sometimes up and down, isn't it? Like, it's really hard. Is this helping? Is this, am I going forward with this worsening, or am I going backwards?
Yeah, I think practitioners have different philosophies on that. So some of them, I think, like to see a herx. I think it's feedback that we're on the right path. I'm of the mind that you've suffered enough. Like, I don't need to see you spending 3 days out of the month, like, incapacitated or worse, like, you've suffered enough. So I really try to support the detox pathways before I go in and kill the bugs, which is why the diet's so important, why sleep is so important, why water is so important. There are a lot of other tools I use. I have 2 chapters on this. Like, I talk about binders. I love, chlorella, and I love Zeobind from BioPure. I love something called Takasumi Supreme, which is like a, petrified bamboo. All of these things, charcoal can be useful. All of these things are really helpful at creating a pathway out. They sort of hang out in the gut and act like a sponge. So they're like slurping toxins down and pulling them down from the liver and the gallbladder and giving them a place to stick so they don't get reabsorbed by the enterohepatic circulation and put back in the bloodstream. And so they end up in the toilet, which is where they should go. And so slowly over time, people who are binding and doing these other things to support their detox pathways are removing the things that are in their kind of proverbial bucket. I think about this idea of a bucket of toxins that we all carry. If it's not overflowing, we feel okay. It's just part of what our liver is churning through and moving to the gut and dealing with. We're breathing them out, we're peeing them out, we're pooping them out, sweating them out. Toxins grow out in our fingernails and our hair. But if those pathways are clogged, or if there's just too much in the bucket, it overflows into symptoms for us. And so I think that if we can handle the bucket, if we can really give people adequate binders, adequate detox support, sometimes I'll use homeopathics. I love homeopathic spagyrics, like the Picana line from Germany is really nice to support the liver, but also open up the terrain, like open up the cells in between and the interstitial space, rather, in between cells in the organs to get things flowing again. I find that to be really helpful so that people don't herx as bad. And if they herx, then we have to change things up, right? I like to think of this balance between your provoking team or your kind of bug killing team and the detox team. And I think of it as a tug of war. Like we want to keep that little flag right in the middle. We don't want the flag to fall in the mud and feel bad. So as you're pulling on the body to release its toxins by killing all these bugs, which of course release their own toxins and create inflammation, you're pulling back with your detox team and you're keeping things in balance so that your body has enough outlet for the things you're elaborating with your treatment so that you don't feel bad. And when you do feel bad, you either do less of the killing and more of the detox, or more of the detox and staying the same with the killing, or you find some way to tweak it to bring things back into balance. And that's part of the intuitive, like, what do I really need here? People will tell me, they'll say, I feel like I need to stop this medication. Okay, we stop it. We stop it and we do more detox, right? Or people will say like, I feel like if I just took some more chlorella, I'd be okay. Okay, let's do it. That's your experiment. That's your PDSA cycle, right? You try it, you see how it goes. I think the more we lean into our body's knowing, the more our body begins to trust that we're listening, and the more it shares with us.
I think that's really important. What's treatment failure about?
Tell me what you mean by treatment failure.
Well, people feel like they've been treated, but they don't feel good. So I know you've covered a lot of things. Is there any things you'd like to highlight in that topic?
Well, I guess I would say this: if you're on a regimen for more than 3 months and nothing's changed, change your regimen. That gives if Lyme is what you're dealing with, all these bugs have different life cycles, and Lyme's is 2 to 4 weeks. So 3 months gives you 3 Lyme life cycles. And in theory, when Lyme wakes up from its life cycle every 2 to 4 weeks and kind of stretches and yawns and starts to replicate and exposes itself to the immune system and to your whatever antimicrobials you're taking, it should be getting killed, and it should be releasing toxins, and it should be either making you feel worse, or if you can get through that herx without feeling it, without your bucket overflowing, then you should feel better after that episode. So if you're not kind of like doing this slow climb to better, or you're not doing these like intermittent herxing without like an upward grade, tells me that we are killing bugs, but we're not doing enough to support your detox. So you're never really recovering from herxing. But if nothing's happening, or you're just getting worse and worse and worse, get off that train. Like, that's not the right train for you.
And just to be clear for the Australian audience, your definition of Lyme in Australia, that term has been gaslit, and they've moved back to it being only the originally discovered Borrelia burgdorferi sensu. Do you include all species of Borrelia in your definition of Lyme, or?
Yeah, I'm an all-inclusive Lyme defining girl.
Me too.
And I even use the word Lyme. I mean, I use the word Lyme to include co-infections of Lyme. I use the word Lyme to include, if someone comes to me and says, I have Lyme, it matters less to me what we're calling it, and more how we're doing with it. Are you feeling better? I really frankly don't care who's there. And I don't do a ton of testing myself. because, I grew up as a doctor in the inner city with people who didn't have money or, any kind of insurance or the possibility of getting any fancy tests. And of course, the regular tests are pretty junky. They miss 60 to 70% of what's actually there in terms of Lyme. And so I really grew up using a clinical diagnosis. I do more testing now since the pandemic because spending time with people on Zooms, I felt like I wasn't as good at like really trusting my intuitive knowing about like clinically what's here. I think I was probably still close enough, but but also people wanted more testing then. I don't know why, but we started testing. I used Vibrant America. I use Vibrant America still. If people want to test, I feel like it is the better test. I know that's controversial. Everyone loves IGeneX, but Vibrant, uses PCR as well as amplification of the DNA, and it's just super, super sensitive. Now, a positive test does not tell you that your symptoms come from that bug. Everyone loves a positive test because it feels so validating. But I still feel like my job is to make sure we're not missing some other reason that you're feeling, if you have not slept in 2 years and you have a positive Lyme test, I can't tell you if your symptoms are from the Lyme or the not sleeping or both or something else, because we haven't gotten there in our conversation yet, So I think it's more important to rely on how you're doing than to rely on a test. And I absolutely wouldn't I wouldn't require testing to keep treating someone who is doing better and better and better.
Yeah.
That to me is just insanity.
And again, for the Australian market, I'd say by far the majority of people no longer will have a doctor. The ones that they have had are gradually getting knocked off by our regulatory body. And, new patients, they have Buckley's, that's an Australian term, hope of getting medical care. So for people without a doctor, what would you advise them today?
I guess my first question is, if that's the way your doctors treat / not treat, don't treat, refuse to treat, gaslight Lyme patients, why do you want a doctor? Like, maybe that's not the train you want to be on. I heard a story recently about someone in Australia who had a positive test and their doctor refused to treat them because Lyme doesn't exist in Australia. It's almost like this is happening, right? La, 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 la. Is that who you want leading your healthcare team? I mean, doctors are great for a lot of things. They're not great for this. They're not great for this, but there are a lot of practitioners who are great for this. A lot of chiropractors and acupuncturists and, energy healers, they see the people who don't get help from the Western medicine trained doctors, and they're really good at what they do. So I would say, don't discount the possibility that you could go a very different route and still get better from Lyme. There's not just one way to get better from Lyme at all, Lyme and co-infections. There's a lot of ways, and you need someone who's willing to think holistically with you about all those other ways.
Thank you for that, Dr. Reihman. And one of the things that inspired me in just our brief time that we've had conversations is your vision and your experience of how having a community around you assists in moving to that pathway to well-being.
Yeah, it
So you
can.
work with patients in community, don't you? In
Yeah,
a lot of group
yeah.
work that you do as people evolve together.
Yeah. I mean, I think it depends on the group, right? Like when I was sick with Lyme, I sought out a couple support groups in my area, and I found them to whip up a lot of fear for me. Like that wasn't in alignment with my getting better. And I had to stop. I couldn't be on all the Facebook pages and websites with people talking about how they were being gaslit by their doctors. I had to really create like a little bubble around myself. And within that bubble, I had to like kind of pull in the people who I knew would support me and believe me and trust me and not bring fear into the bubble. Like, I think you have to make some really clear boundaries around yourself, because and it's not through no fault of their own sometimes, right? It can be a very scary illness. And I think Lyme itself brings in the emotion of fear. Babesia certainly brings in the emotion of fear, right? Just panic. So start to recognize when you're feeling those things and separate out from them a little bit. Like, oh, I'm feeling Babesia's panic right now. I'm going to set that to the side as much as I can. Continue to love myself and breathe while Babesia has its tantrum. I'm going to notice that my doctor is making me feel like a liar or a crazy person, I'm going to gently remove myself from that relationship. I don't have to give feedback to the doctor. I just need to leave that room, right? I need to set some clear boundaries and not let people into my healing zone who aren't actually healing. So yes, I think people and other people can be very, very powerful, but I think we have to curate who we bring in there, especially while we're vulnerable and healing. They have to be high vibration people who are going to inspire us to the next step, who are going to keep us connected to our goals. So I love the idea of healing in community. I've always loved it. When I was in residency, I ran an acupuncture group visit for smoking cessation in the inner city. I ran prenatal groups. I feel like we as humans are meant to sit around a campfire together and support each other. And so in every possible way that we can recreate that for ourselves, I think we only stand to win, and others win too. Because when you're part of someone else's process, even in a small way, but you feel instrumental in elevating them even a tiny bit, it's an active service that elevates everybody. So yeah, I like to find your healing team, find and curate and cultivate your healing team. It's out there. It's out there.
I think in Western society, we're being called to rise up and take our power back in the healthcare environment, right? We're used to being,
now I have goosebumps. That's exactly right. Yes. Yes.
I was raised to go to the doctor and do as I was told, right? And I was so betrayed by that over the years. And it took me a while to really go and say, no, what you're saying to me is not true, and take my power back. And I think, I'm with you, and we need to bring a lot of people in our world along with us on that journey, because there's never been a more obvious time that that's crucial.
Yeah. Well, I'm so pleased that you found your inner strength and you moved on from a paradigm that wasn't serving you. And on behalf of all the doctors who have gaslit you, and I'm talking to anyone who's listening to this, right? On behalf of all the doctors in the medical system that has failed you, I want to say, I'm sorry. I'm sorry that we did that to you. Like, that's not okay. And you can leave doctors behind if they're not on your team.
Yeah. I mean, I was part of that system, and I apologize for my part in it back then, 20 some years ago. But and this isn't to take away from all the amazing ones that have their hands tied in Australia right now, who fought so hard for us, but we all know the ones that, but drink the Kool-Aid or whatever we want to nicely say about it.
Yeah.
Do as they're told, and they've forgotten how to be curious and inquisitive and questioning in medicine. They're now educated to do what they're told, and that's dangerous for us as patients.
Yeah.
So I know we're going to offer Australians a special offer in a minute, but that's a bit time sensitive. But I would like to cover, the Healing Grove. So that's the community. What's unique about the Healing Grove, in whether they choose to do that with you or whether they create that in their own way, that healing, the environment of coming together to heal?
Yeah. So I wanted to create a space where people could come together and feel welcome and feel not judged and feel free to learn about things that they could explore together and lean into, when it felt right, and get support around that too. And so I brought people into an online community. It's called the Healing Grove, and it's a membership model. And everyone's welcome to come join us. It's a beautiful gathering once a week. And twice a month, we have like a support call where I facilitate kind of a community experience where people are sharing celebrations and successes and holding one another accountable to our stated goals. Like that, we have one member who says, I'm trying to stay positive. And so when she veers off, we support her in bringing her back into her intention, that kind of thing. Once a month, I bring on an expert. So I've had lots of people who are Lyme literate, because that's kind of one of my most important segments of my population and something I'm passionate about. But we also have people who've talked about mold and how to discover mold in your home. We've had people who've talked about, we had Carrie Rivera come talk about CD, for example. We had people who talk about detoxification, and it's me bringing all the tools that I've learned about or am learning about to my audience so that they can learn, again, probe all areas of the known universe for things that could be supportive of their healing. And then once a month, I host an office hour. So I kind of put on my doctor hat and people bring their questions and maybe their lab values, and we look at them together in the group online. And it's really taken off. The first year I did it, I thought it was just going to be a summit. You know, I had 50 pre-recorded interviews with amazing people, and I launched it for free for 2 weeks and shared it with the world. And it was beautiful, but there were people who said, you have to keep this going. We want to meet. And so we met every month that year, first year. This is now our third year, and we're meeting weekly, and it just gets richer and richer. I tend to share whatever I'm doing and teaching and offering to the Healing Grove members, which includes my ebook. It includes the various offerings I've done, like the courses I put together. I have a course starting in a few days on the elimination diet, which I decided to build into a course because, again, I just think it's so powerful. And most importantly for people with Lyme, because your immune system, 70% of your immune cells are in the lining of your gut at any one time. And if you're putting things in your mouth that are creating inflammation unbeknownst to you, or even beknownst to you, you're going to be distracting your immune system from doing their real job, which is to manage the Lyme in your body and get it down. And I've truly seen people recover from chronic Lyme just with an elimination diet. Usually it's kids, people who are less toxic and have less of a kind of chronological burden. But seriously, like kids with like pages and pages of tick bite references. These are the pictures of his bullseyes from age 6 and age 9. I mean, kids who couldn't get off my couch go back to playing soccer and feel amazing after just an elimination diet. And then, of course, following what their body asks them to eat after they get back onto the foods. So the Healing Grove is where I share all this stuff and do a lot of teaching. It's kind of my inner circle of wellness seekers. It's where I take us to places that I don't usually take people on the first date, although we got there. We talked about CD, we talked about parasites, we've talked about some of the controversial topics, but it's where we really like dig in and explore those things and support each other. And I have probably half of that community are people who are recovering from Lyme disease or something similar, a complex chronic thing, mold. Yeah.
Awesome. And so what's in your heart to leave Australians sick with Lyme and associated diseases today?
Well, I guess I'd want you to hear that if you're suffering and you're sick, it doesn't matter how long that's been, you can recover. Like, this doesn't have to be the rest of your narrative, right? This is a chapter. It might be a really crappy chapter, but it's just a chapter, right? You're the author of this book, and you can write yourself into a new chapter. You're probably going to need a team. You're probably going to need to find some people who will support you in your choices and help you explore new things. Maybe even prescribe something if you need that on your list of items you're trying. But, you really can move through this. I don't believe it's true that people need to go down with this. I believe everyone has the capacity to recover.
Dr. Reihman, thank you so much. God bless you. For those of you listening in, this is April 2023. We will put some information about the immediately upcoming resources that will be available to you and a special offer for Australians. If you're listening to this later down the track, we'll also have links available for you that you can connect with Dr. Reihman internationally. So God bless you, and thanks everybody.
Thank you. It's been a pleasure.